So this morning we are doing a dental cleaning on a cat named Milo. We knew that Milo would have at least 2 extractions. He has visible holes in his teeth. So cats get dental disease known as tooth resorption. We don't really understand why this happens, but they get cavities in their teeth that eat away at the teeth, and eventually the crown of the tooth falls off, leaving the root and the nerve exposed. They can be painful for a long time if we don't extract them. There really isn't any treatment for them, and we have no way to stop more teeth from doing the same thing, so we just have to extract them as they occur. So this is Milo's first dental x-ray. This tooth is normal. The crown is nice and white, and there's a clear black line going around each root. This is kind of a top-down view, so I don't see the roots as clearly as if it's a side-on view, but you can see that nice black line. That's where the ligaments are, the tiny, fine little connections between the bone and the tooth root. This tooth here, you can see that you can't see a black line. That root is being reabsorbed into the bone, and it's basically dissolving away. So instead of crisp and white, it's kind of gray and fuzzy. This tooth is one of the canine or fang teeth. There should be a nice clear white root coming all the way down to here, but this too, there's a big hole in the crown, and the root is dissolving and basically being reabsorbed back into the cat's bone tissue. So this is another view of the same thing, a side view of that little tooth that is dissolving away, and then another view of that canine tooth. And again, you can't see the root, and there's a big hole. So this is visible on the outside. This is how we could tell that there's a problem. There's a red spot on the tooth where the pulp of the tooth is exposed. His other views look pretty similar. So this is another view of that same canine tooth and the one on the other side, which also has a big hole in it. So this is the other side. This is a normal tooth. Again, everything's nice and white, and there's no big holes in it, so that tooth is fine. Here's another view of that left upper canine, which has the same thing as the right upper canine we just saw. On the bottom jaw, there's only 1 tooth left. This cat has already lost several teeth to tooth resorption. This tooth is normal. So again, nice white crown. You can see a little black in here where the pulp is, and then this nice black line coming all the way around the root that tells you that that root is healthy and it's well attached to the bone. This is the same tooth on the other side, and you can see these holes being eaten away, and you can no longer see much of the root structure. It's all being reabsorbed into the bone. And we just buzzed by the picture of the lower canine teeth. This is a giant hole in the tooth. This is a smaller hole, and both of these roots are being reabsorbed. So I'm going to need to extract all 4 of those canine teeth, and then 2 premolars, the small one on the upper right and a lower left one that's those are just the small teeth. Luckily, cats, once they heal, do very well without a lot of teeth. They still usually will eat dry food. They function quite fine. They wouldn't be able to hunt very effectively in the wild. You need your fang teeth in order to grab a mouse, but they do fine in an indoor environment. And in fact, they're a lot more comfortable once we get those painful reabsorbing teeth out of their mouths. So this cat, even under anesthesia, when we touch any of these teeth that have these lesions, his jaw will chatter because he's so sensitized and painful with those teeth. So we're going to make him feel a lot better. He will just go home with less teeth than he came in with.